Rasmussen-Torvik from Northwestern University. I work in the department that Jeremiah Stamler founded over 50 years ago, so it's such a pleasure to be here today interviewing this year's Stamler Award winner at AHA Epi 2024, Dr. Wendy Wang.
Thank you.
So I just wanted to remind everyone watching what exactly the Stamler Award is about. The Jeremiah Stamler and Rose Stamler Research Award for New Investigators is named for the Stamlers in appreciation of their seminal contributions to cardiovascular disease epidemiology. The award recognizes and stimulates excellence in research by investigators in training. And Dr. Wang, you are a postdoc at the University of Minnesota, and you have been nominated for this award 3 years in a row. So clearly you have been, submitting amazingly high quality research to this conference for many years. So it's such a wonderful thing to see you recognized in this way.
Thank you. It's an honor. Persistence is key. Third
Persistence
time's the
and
charm.
So I'd love to hear a little bit about why you decided to choose this particular topic to investigate and submit this year.
So SGLT2 inhibitors are this novel class of medications that have been in the news recently for all of its protective benefits, particularly in regards to, I think, cardiovascular disease, but more recently with recent recognition looking at kidney disease and cardiovascular kidney metabolic disease. I think looking at prevention of chronic kidney disease is an important topic that probably we can look into more. So that's why we had decided to look at SGLT2s and CKD to see if there are any prevention strategies for it.
And when I was looking through the abstracts, you used market scan, and this is a pharmacoepi analysis, which is a little bit unique to this conference. Do you want to tell people a little bit about market scan? They may not be as familiar with that as some of the cohorts that are touched on repeatedly in this meeting.
Yeah, of course. So market scan is an administrative database. It looks at billing claims from inpatient, outpatient, and pharmacy services. So I think a big strength of market scan is it is a large sample size. So you can really tease out a lot of different subgroups that may not be able to do in the cohort studies. In addition, I think another strength is looking at like head-to-head comparisons of medications that a lot of randomized control trials aren't funded to do. So I think it's a really great resource that can complement results from randomized clinical trials that we see.
So what do you think was the primary or the most important finding?
So overall, we did note that SGLT2 inhibitors did reduce the risk for chronic kidney disease compared to other second-line medications. And then we did, because we are using market scan, we were able to do a few subgroup analyses. So one of the ones we looked at was head-to-head comparisons of these SGLT2 inhibitors. I think we had hypothesized that there would be it'd be like an overall class effect, so there wouldn't be any differences between these inhibitors. But we did note that one of them did increase the risk for CKD compared to the other two SGLT2 inhibitors. So I think with these results, additional research really needs to be looking at the different types of SGLT2 inhibitors.
And I think you mentioned this in your talk, but maybe was there a suggestion of that from other trials, et cetera?
Yeah, so we looked at a previous report from the FDA's adverse event reporting system, and they did note that one of the medications did have more acute kidney injuries than the other two medications. So I think looking at mechanisms of why that is the case is needed.
So what do you think is the next step in this research?
So next steps, I think, well, first looking at the different types of SGLT2 inhibitors compared to one another would be important. And I think another great aspect would be to look at like GLP-1 receptor agonists, because I think that is a hot topic in society in general, and also at the AHA Epi Lifestyle sessions here with the debate that we had. So I think looking at those medications in market scan could be useful, especially maybe like side effects that we may not have known about.
Market scan seems to be maybe one of the only places we're going to have good sample size to look at some of those analyses, at least early on. So it'll be really interesting to look at that.
Yep, I agree.
Well, congratulations, such a well-deserved win.
Thank you.
And wonderful to hear about your research today.
Thank you. Thanks for having me.